Of all the many decisions we make throughout our life, there are probably none more meaningful than those we make for another person, especially when they're unable to speak for themselves. Many times, this happens when those we care for need medical care and are unable to tell us their wishes and what matters most to them. When this happens, knowing the right thing to do and making decisions that they would choose if they could can be very difficult and stressful. Sometimes we're the person that they have chosen to speak for them, and sometimes we're not. But as people who care for them, it is important to understand the importance of life planning and the medical decision-making process through advanced care planning.
We're going to be checking your vision like this.
Quality medical care involves more than receiving the right medicine. It involves making sure that treatment and care decisions match the wishes and values of the patient receiving the care. This may seem easy, but it isn't always, especially when the patient has not discussed what they want with someone they trust. When a loved one needs care and can't speak for themselves due to a medical illness or condition, not having a medical decision maker who understands their preferences and can speak to their medical care team on their behalf means that doctors and other caregivers, including you, will have to make decisions based on what they think the patient wants rather than what they do want. This can be very stressful for everyone and can be particularly distressing if you are the patient's caregiver. It is important to have peace of mind knowing that the decisions made are those that the patient would want. Whether someone is young and healthy or managing a medical condition at any stage of life, encouraging people to think about the kinds of treatments they would want and who can make those decisions can be difficult, regardless of their health condition. Having a conversation with them about this is an important first step in advanced care planning process. You can begin by choosing a quiet place and time to begin this conversation. Start by sharing the ways you think you would support them if they're unable to speak for themselves. You could also share your concern over making the right medical decision for them in the case of an emergency. Some people are not comfortable having this discussion, and that's okay. Beginning the conversation and encouraging them to think about it is a good place to begin. You don't want to force the issue. If they are comfortable talking about their wishes, you should also ask them about the things that matter most to them and the types of medical care they would want, including where they want to receive care and who they want to make their medical decisions, which is known as a surrogate decision maker. Helping them understand that choosing a medical decision maker now will give everyone peace of mind knowing their wishes are understood and followed without second guessing. The final step in the process of advanced care planning is for your loved one to complete an advance directive. This is a written record of their wishes and is what you and the medical care team will use to help make important decisions with peace of mind, knowing they are what your loved one would choose for themselves.